Welcome back. Our next guest is Dr. Eric Gwynn with Coastal Carolina Hospital. Dr. Gwynn, good to see you.
Good to see you. Thanks for having me.
A recent study from the Mayo Clinic suggests that both men and women in the United States are getting more kidney stones. Now, this is very specific. Why is this happening?
Well, one of the parts of the study was that we use more imaging, such as CT scan, now during the study time. So I think we're picking up a lot more kidney stones that we may not have seen before. We're actually getting to treat them before they become symptomatic.
So a lot of people, I believe, have heard of this, but they may not know exactly what this is. What are kidney stones?
So kidney stones are mineral deposits, crystals that can form in the kidney, either because the patient has a metabolic disturbance or they don't drink enough fluids. We become dehydrated and these crystals begin to form stones in the urinary tract, which can then become very painful.
So dehydration, you mentioned, is one of the causes. Are there others that we need to be aware of?
Dehydration is probably one of the #1 causes. High salt intake in your diet, a diet that's high in animal fats. These are all things, and then we also live in what's called the stone belt.
Interesting. So tell us, what are the symptoms of this condition?
Symptoms of a kidney stone can include severe pain in your side, your flank, lower abdomen associated with nausea, vomiting, and this is a fairly severe pain that will bring most people to the emergency room. Possibly blood in the urine as well can be associated.
And is that quick onset or does that happen over time?
Usually these are very quick onset. This is within 30 minutes or so you'll begin to get this severe, intense flank pain that usually brings the patient in for evaluation.
So let's say you have the symptoms, you go to the doctor, and it turns out that this is what you have. How is it treated?
So one of the first things we want to look at is where the stone is, what the size is, because some stones can be managed conservatively. As you know, certain patients can pass a stone given its size. Other potential treatment options are more non-invasive shockwave lithotripsy, which uses sound waves to treat your stone, versus an endoscopic technique where we use a small scope to go up and fragment your stone and remove it.
Well, none of these sound particularly pleasant, so I'm sure everyone's wondering, how exactly do we prevent these?
So prevention of kidney stones, in general, one of the #1s is increasing your fluid intake, because where we live is a very hot climate, and so therefore dehydration leads to formation of kidney stones. I think a lower salt diet, a diet that's lower in animal fats, these are all things you can do, and sometimes it could be a medication cause or potentially the need for a medication to prevent these stones.
Well, very useful and actionable information, Dr. Gwynn. Thank you very much for your time and for sharing with us today.
Thank you.